All right, well, it's ticked over to 1 minute past the hour. So I think we can make a start and people can trickle in as they need to. Yeah, we may as well get started. So welcome everybody to our second webinar. This is exciting for us in the Nourishing Futures Network. My name's Julia Zinger and I'm a co-lead of the network. And I'm really happy to chair this webinar today. We have an excellent range of speakers. We have Brenda, Carmen and Jane, and they're presenting their work today. And I'll give them all a proper introduction before their respective presentations. We've got a huge number of people registered for this webinar, which is really exciting. It's record numbers, and that's a little bit tongue-in-cheek. This is only our second webinar, but we beat our first webinar number, so that's good. And it's really wonderful to see that this topic of food insecurity or food security in the first 2001 days is getting the attention it deserves. So today's webinar will consist of 3 presentations, and they'll be back-to-back, followed by a panel discussion involving all 3 speakers. So the questions for each panel speaker will be collated for that panel discussion at the end. Please do write your questions in the Q&A box, and we'll aim to address all of your questions if we can, if we've got the time. Your mic will remain on mute for the whole of the webinar, so please just put your questions in the chat box instead. And just a reminder, we are recording this session and we will upload the recording to our Nourishing Futures Network website. Now, to tell you a little bit more about our Nourishing Futures Network and invite you all to join, I'm going to hand over to my colleague, Leslie Frank, and she's another co-lead of the network, so she can give us a quick opening address. Thanks, Leslie.
Thank you, Julia. So I'm Leslie Frank, and I'm the director of the Fed Family Lab at Acadia University in Nova Scotia, Canada. And I have the great pleasure of welcoming you all on behalf of the leadership team of the Nourishing Futures Network today. So the name of our webinar today is Feeding Futures, Advancing Food Security in the First 2001 Days Through Multi-Sectorial Action. And the leadership team is all or maybe mostly here today, and hopefully they will have an opportunity to introduce themselves as they participate. We also acknowledge that we have attendees joining us from around the world today, and that we are all connecting from diverse traditional lands. I'm welcoming you from Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. And we are coming together to think about food insecurity during the first 2001 days. And my own reflections as a settler on this land make me think of many social injustices related to food and health that are part of our colonial histories and legacies that continue today. And we have many lessons that we can learn as we move forward in this work. And I encourage us all to reflect on the traditional territories from which we're all joining from. So just as you think about that, maybe we can move to the slide 2, Julia. I'm not sure who's controlling slides, and because I can't see them.
Yeah, well, that's fine. You don't have them to hand there, Leslie?
Okay, then I'll just talk.
Yeah, just talk. That's fine.
Don't worry about it. I had a slide that sort of had some points about the network. So I'm just going to say a little bit about, for those of you that are unfamiliar with the Nourishing Futures Network. We're an international group leading multidisciplinary research and collaboration across research and policy and practice, and engaged with those with lived experience, all on issues of food insecurity during preconception, pregnancy, and early life, what we term the first 2001 days. And we're focused on creating a platform for collaboration on the health impacts of food insecurity for mothers and their children during this vital life course stage, but also the structural and intersectional social drivers of food insecurity that are unique to this time of life, and policy and practice interventions to prevent and mitigate the harms that occur. So ultimately, we want to generate change together and improve the life course health of women and children. And becoming a member will broaden the network, will make us stronger and shape our future as a group of people. And if you haven't already joined, we'd love to have you as a new member. And I was going to say you can follow the QR code on the, oh, there it is. So get your camera out.
There you go.
To register for the network, you can just follow that code. The network's first webinar was in the summer of 2022. So if you've missed it, you can watch the recorded presentation on our website. So here we are on our second webinar, as Julia said, and we're planning for more. So if anyone is interested in contributing to a webinar or hosting or has just an idea for a webinar focus, please be in touch. And also coming soon, we're launching something called the Nourishing Futures Network Bite Size. So this is an opportunity for members to share information on either published or work in progress that you're engaged in, or a community talk or policy intervention that you would like featured on our website. So if you're interested in doing a bite-sized contribution, it's just a short 3-minute talk that we would post on our website. So we have also just had our first in-person convening in Newcastle in 2024. It was a 1-day conference followed by a 2-day working symposium where we all got together, and we really hope to reconvene in 2026. So watch for information on when and where and how you can participate coming soon on, hopefully, as we think that through, information on our website and mailed out through a newsletter, which if you join the network, you can also have access to through your email. So that's all for me. Once again, welcome from the leadership team, and I'll pass it back to Julia.
Excellent. Thank you, Leslie. Sorry about that slide mishap, but anyway, we got there. That's great. Okay, so first speaker for our webinar. This is going to be Brenda Black starting up for us today. So Brenda is a registered dietitian and CEO of Edinburgh Community Food, which is a charity and social enterprise. She has over 25 years of experience in a whole range of sectors. A lot to actually read out there, Brenda. Your work, I know, focuses on supporting nutritionally vulnerable populations, a particular emphasis on maternal and child health, food security and health equity. Brenda is currently undertaking a Churchill Fellowship to explore strategies to improve health outcomes for food insecure young mums and children, and that to occur around the globe, including to spend some time with Leslie Frank, who we just. So I'm really excited to hear what Brenda has to share with us today. So thank you so much, Brenda.
Thank you so much. Can you just give me a thumbs up, Julia, that you can see my slide okay?
I can certainly.
Terrific. Thank you so much. Well, thank you everybody for coming along today. I'm really excited to be able to share some of my work with you, and thank you to the Nourishing Futures team for inviting me and giving me this opportunity. Today I'm sharing a wee bit about my Churchill Fellowship journey, exploring how young mothers and children are the shock absorbers for society. And I realise how strong that word shock is going to be, and you will hear me referring to that throughout my presentation today. So where did this all start? It started with a series of shocks that stopped me in my tracks. Let's see if I can. Right. Okay. So here's the shocks that ignited my spark. if you think about these shocks that I've listed here, there was 4 shocks, and you know, we all go into meetings that we are sitting and listening, and we all are guilty of zoning out, and then you hear the nugget of a shock coming through, and that's what these did to me in meetings. If you think about the first one, where young mothers were the highest poverty group, 55% under 25 in Edinburgh. Now, if you think about Edinburgh, it has the highest density of private schools in the UK. Number 2 was about the social work referrals, and that was young mothers who were unable to feed their children were getting a direct social work referral. Number 3, around formula milk turmoil. We have global turmoil around formula milk, and in Scotland we were creating a pathway. And during that whole journey, we found out there was problems with access, there was judgment going around formula milk, there was market forces at play, there was just chaos in terms of formula milk. And then the last thing was particularly shocking in terms of we're a grassroots organisation, and when we're working with young mothers and we bring them into our community to talk about how they're accessing food and money and things like that, Scottish Government have got a policy of being cash first, which means that instead of giving food, that we try to give young mothers cash. And when we started to talk to these young mothers about it, young mothers expressed a fear of handling money and thought that they couldn't be trusted. And I think that we'll all feel on this call just how shocking that is. Now, what did I do about that? I felt upset. I needed a way to help and a way to act with people. And that's when I already knew Lindsay Graham, and I don't know if Lindsay's on the call today, but Lindsay's part in Nourishing Futures Network, and she's also a Churchill Fellow. And she introduced me to the fellowship. And the fellowship is an opportunity that you take a problem that you see in society and you explore how to solve it. I think it's easy for us all to see problems. It's finding solutions and the journey that we go on to find the solutions. And I'm like everybody else on this call, and like lots of people joining from different time zones, we're all very busy. So taking another problem on is a big step forward. But with the support of the Churchill Fellowship, I was able to do that and hopefully help others around me and help myself to move on and help in this journey. So when I talk about shock absorbers, it was really interesting that every time I met mothers and I read the research around this, I saw them being buffeted, not just being buffeted by, you know, the internal things in their family, but by society, the financial support, the restructuring of public health, the new benefits system. And there was all these system shocks. And like shock absorbers in a car, they cushion the impact for their children, they cushion the impact for everybody around them, but it comes at a heavy personal cost. The mothers absorb the shock by going without. It costs them physically, and it costs them mentally, and it costs them emotionally. And I think that we've really got to think about where these mothers get their help and how we can support them. Now, the impact does not just stay with the mother. The mother does shield the child, but the mother's well-being directly affects the development of the child. So even though if mothers are trying to stop those shocks, you cannot help but feel that these children, and we can't say that the child is okay, we cannot neglect the mother, but we know that it will have an impact on the child. And a lot of the research that I found on my journey has supported that. So where did I start? In terms of the fellowship context, I started with Edinburgh Community Foods. We were finding there was gaps in a lot of the provision, not just for the young mothers, but also for professionals. We'd put on some small courses on weaning and fuss eating, and we found that we were inundated by professionals trying to link onto these courses. And we felt that the young mothers weren't getting a chance to go to attend the courses. So we found that that was a gap. We also found that the mothers were, as I said before, were fearful of handling money. So there was things on the ground happen. In terms of Scotland, there's a child poverty focus, and the Scottish Government have done quite a lot of things. And when I visited the countries that I visited, and when I talked to the people I talked to around this, people are looking at Scotland and they're watching Scotland. All I would say is that although Scotland has a child poverty focus, we must check the detail, and that's something that will come up throughout this. In terms of internationally, I was lucky enough to be at the Newcastle event with the Nourishing Futures Network last year. I met exceptional experts in this field who were encouraging. They were like a family. I've just come on the call with them today and they're so supportive. I am not an academic. I am a chief exec of a community organisation. I'm a dietitian by background and, you know, came from a retail background, but they made me feel as if I had something to give and to offer, and I can't thank them enough for that. And I do think that I do have something to give and to offer. So when I thought about doing my international visits, it was them that I went to think about where I should go and how I should approach this. And when I looked at the international visits, I decided to start in Rome, and I'll tell you a wee bit that a wee later on, Toronto and Nova Scotia in Canada. So the starting point for a lot of my research was reading books, and Leslie's on this call. She's produced a unique book, Out of Milk, and also the Stop book from Nick Saul in terms of Toronto, in terms of food insecurity. I also started off with the Proof Project in Toronto, which was around cash first approaches and around supporting young mothers and families. And she started with these pieces of research in these books to start to build my journey. I've put Invisible Women there because on the journey there was things that kept coming up all the time, and Invisible Women was it was a theme, that a golden thread that ran through this, that I really think that it's important to recognise that when a lot of the programmes and things that we do and the research that I plunged into, sometimes women were not accounted for in it. So what is the current status? So I plunged right into the research, and bearing in mind this is such a fast moving and an all-absorbing area, and it's not exactly my day job. But all the research links that I've got will be provided at the end. But I've put up some of the current things that are going on in terms of the young penalty, the feminism of poverty, and also things like, you know, if I thought that there was 4 things stacked against these young mothers, there's 24. Every time I opened a different piece of research, there was another barrier. The barrier of a career for a young mother who hasn't got career maturity, that has to take a career break right at the very beginning of career and never gets back on that career ladder and never is able to get the same rate of pay as other people working beside her. There's so many barriers. So how do we raise the voices, improve the lives of these young mothers? And I decided, you know, as I said before, to start my journey in Rome. So when I went to Rome because I felt it was like that global end of food, and talked to the big NGOs. It was at that macro end where they're involved in a lot of things about human rights. So this is all the organisations that I went to see. There was a lot of flags, there was a lot of strategy, there was a lot of human rights, and there was a lot of great people. But what there wasn't was a lot of understanding about grassroots. They had the same problems as grassroots, where they don't have sustainable funding for a lot of the community projects they do. But there was a disconnect, and I couldn't understand where we have big global projects and we put cash into food crisis situations, and we put infrastructure for the food system into these crisis situations. Why don't we use that learning to go into our own food systems and our own crisis situations? But I couldn't find the connection. The connection isn't there. And, you know, I think that needs far more work to be able to find it. One of the great things about Rome is they love food. It is the heart of food. And every piece of food that I've seen in terms of crisis food was the best quality food. And I met a lot of migrant mothers. I worked in some social supermarkets. I went to markets and collected surplus food. But again, they were really interested in this cash first report support that we were given in Scotland, but they were also quite remote from what the reality was. My next step in my journey was to Toronto. Now, Toronto celebrates food. It's a cultural sharing around food, but there's a stark gentrification that mirrors both Edinburgh and Rome. I've not went into a lot of things about the homelessness that young mothers will face, but there is a definite thing in terms of the cities that a lot of the mothers are staying in, where there's a disconnection because of the gentrification of communities. There's a lack of affordable housing. There's a lack of community because the communities are so fragmented. But it's such a dynamic city, and I loved every part of it. I'll just move on from this slide to show you more in people in Toronto. The people in Toronto that I met in terms of the food system, I met a young mother and her son who were basically setting up a food co-op for the first time. And I thought that in terms of Toronto, what I could really see is that migrants and people from different cultures and young mothers had something to share. They had an enterprise that they could create through food sharing, but not just building enterprise, but actually building connection. There was an over-reliance in food distribution, crisis food distribution in Toronto. There is a kind of thought that, you know, the food bank and the surplus food model will solve the problem of food insecurity. It won't, and it doesn't. There was a good health system, there was dental services, but there was formula milk in cages in supermarket, which I'm sure that, you know, we don't want to see in terms of dignity and the stigma that it leaves a young mother to go up and ask somebody for a key so that she can look at a formula milk carton. The next step in my travel was to go to Nova Scotia, and you know, Leslie's on the call. She hosted my visit to Nova Scotia. Nova Scotia was very close to Scotland. I've seen a lot of gold standard community groups, and Leslie, being my guide, has got a real in-depth knowledge of these groups. She's worked with them, alongside them, and champions their work. And I don't know if we can capture that ingredient that Leslie has with our community, but I wish we could bottle it and share it with the world, because it is unique and it is something that we should be striving for. We shouldn't be going to communities and just lifting what they can give us and leave. We should be working alongside them. What I did see in the communities was women who were mature in their community that were sacrificing their pension and their rate of pay in their career to help younger women. They had really small resources, but they were achieving big impacts. On this picture, there's a small picture of a mother cutting through with a pram. I don't know if you can see it, but it was a community cut through. And when they built the community, they kept the cut through. And I think that's a great analogy, is that when you build something new for a community, if they know a path and they use that path, follow the path, they'll have the solution. And this is more in terms of, I think Jane's on those pictures as well. So what can I tell you from a community development lens? Okay, we have an opportunity here in terms of we don't always recognise that we can have a 2-generational impact. Mothers are just not the recipients of the help. I frequently get challenged on why I want to help mothers so much, but I'm not going to step away from it. I know that we've got a chance to help 2 generations, and I know that stability does matter, and I know that the help that we give people long term will set the next generation up. There are worrying trends emerging. Mothers already see what's wrong. Supporting their interventions yields 2-generational impacts and stability. The emerging trends are food banks are not the solution and they're unsustainable, and we need to move on. Shocks are getting faster and deeper. Programmes targeted to young mothers that finish and are not considered worthy of investment to go on, thinking that you do it once and you're done, is not going to work. And there's good evidence that austerity has a greater effect on young mothers than other sections in society. And that's why they need our help more than other people in society. Just try and find my... Okay, so key findings. Investing in young years pays off. Mothers sacrifice their own well-being for their children. We hear it time and time again. Short-term funding and fragmented systems leave mothers isolated. And obviously the gentrification that I mentioned before, we have such a narrow window of opportunity. Young mothers are in that motherhood bubble, and before you know it, they've moved on and they have another barrier to overcome, and they forget what they've left behind. And I think we need to capture them just at the right moment to be able to make the changes and help through, because they already have moved on, and it's up to us to make sure that we capture it as much as possible. This is my interim reflections, because I'm not finished my report yet, and I'll tell you about that in a wee bit more. Young mothers face the same issues worldwide. My report will document the shock after shock. People say I'm too focused on women. As I say, I make no apology. We must continue to drive international and local change. We need to raise the income of the young mothers. And in terms of my call to action, I need to produce my report. I need to share the shocks that I've seen, and we need to continue. I urge everyone to use your strength, because we know that when women get into power and get into positions of strength, they help women more. So spark empowerment in other women and join the Nourishing Foods Network. Thank you so much for listening.
Amazing, Brenda. Wow. It's 11:30 at night for me, and I am feeling so awake and alive and energized by that. That was so compelling. Just absolutely marvelous and wonderful. And yeah, I mean, I've written quite a few notes here, and I'm really quite shocked about the young women's fear that they can't be trusted, or they can't trust themselves with money like that. Whew, that really hit me hard. So we will move on, though, to the next speaker, and we'll have a great chance for further discussion in our panel discussion later on. But thank you so much, Brenda.